pallor, how you look for jaundice, how you look for cyanosis, how you say the patient build is average, how you say the patient build is poor. So one question will come from, definitely will come from the general physical examination. So you should know how to look for the pallor, how to look for the jaundice, how to look for the pedal edema, how to look for the clubbing, how to look for say generalized or lymphadenopathy, how to look for the blood pressure, how to look for the pulse. This you can get one question from the general physical examination part also. And another important topic in general physical examination is, which I always try to tell to my students, is about a Karnofsky performance status. Now this is a status where we'd like to say that with whatever element the patient is having, how much time the patient is active or how much time the patient is on bed. If the patient is fully active, there are so many patients who, beside having lot of diseases or a lot of suffering, they have such a strong willpower that they cope up with their situation and they are able to do their normal activity. So this will tell you about how the patient is going to respond to your treatment, because for a treatment the willpower of the patient is very important. Say for example, if you ask the patient to, after MRM, you ask the patient to take chemotherapy or the radiotherapy, but you find the patient is not willing, or the patient has missed the dose, patient has missed the cycle, so a patient does not have very good willpower. So that in that particular time you can do counseling of the patient and try to convince him that he has to take the full and proper treatment. Then there comes to the systemic examination. Now, when the patient is already come to you, I always say that look, if the patient has come to you with a particular problem, and the patient is with you, you have to find what other disease the patient is having. Might be the patient is admitted in your surgery ward and you find first time the patient is a diabetic, or the patient is hypertensive, or the patient is having some medical condition associated with him or with her. So then that time you can't say that no, the patient is with the surgical ward, we'll just concentrate say about the abdominal lump or breast lump. If the patient is having any systemic condition, you have to take note of it, and you have to take opinion or reference from the concerned department. So for that's why you have to do full examination of the respiratory system, cardiovascular system, nervous system. These are the basic examination that you should know how to do in the systemic examination part of your case presentation. Might be few questions will be asked. How is the respiratory condition? Say you say the bilateral air intake is normal, there is no added sound, no bronchitis or no crepitation. Similarly in the heart, CVS, you can say S1 and S2 is heart normally, and there is no added sound or added murmur. In the nervous system, you have to, beside mentioning about the GCs of the patient, you mentioned about the superficial and deep nerves and the cranial nerve examination. Some exam, I mean, I'm very sure that in the surgical examination, no one will catch you at this point, but you should know about it. Might be some examiner will ask some question related to this. So this is systemic examination. Then examination is the local examination. Now this local examination is the examination of the part we are concerned. Now with what particular the problem the patient has come to us, we have to take it in the local examination. Just for example, patient has come with the complaint of swelling over the inguinal region. So now we concentrate on the inguinal region. Definitely you have, if the patient is having hernia, and I will take each and every case in my next videos and try to elaborate about the case. But in the local examination, every lump or swelling or any say abdominal examination, breast examination, they have got a prescribed format, and you should know about the format and you should go up according to the format. Don't try to skip anything. So this you have to write about inspection, then palpation, then percussion, then auscultation. Make it a chart, and then if there is a case of peripheral vascular disease, then you have to make a chart about the peripheral arteries on the right side, the left side mark. This I will take in my further videos when I discuss about the peripheral vascular disease. Now, once your whole examination is complete, then give a brief summary to examiner. Now, to summarize yourself, you can say, my patient, Mr. Jatin, say 23-year-old male, was admitted to my hospital on this particular days with this cheese complaint. This was the history of present illness. This is his build, nourishment, and these are findings of the local examination. Now you start giving the provisional diagnosis. In provisional diagnosis, try to give at least 2 to 3 diagnoses to the patient, to the examiner. Like my thought goes towards my most common, my first priority of the provisional diagnosis is this. Then other diagnosis that can be done. The examiner might ask you why you think that about the other diagnosis. Then you should have some brief description about it. Why you think that other examination can be there. Then this thing after the diagnosis, the next question will come to you: what you are going to do for this patient. Now always start with, I would like to investigate the patient for the present disease and what has caused this present disease and what this particular disease can cause in future. Now taking consideration all these, we are going to do few investigation. Few examinations are routine to all the patient, routine blood examinations and all, and few examinations like particularly CT, MRI or PET scan or tumor markers, they are specific to specific disease. That will take when I'll go for each and every case. So then another in the local exams, a very important thing I want to tell you, that during examination, after you complete your local examination, you have to mention whether you have done PR or PV examination or not. No, I find many examiners are very concerned whether you have done, in the surgical cases mainly, PR and PV examination. So whether you have done it or not, you have to mention that PR or PV examination is need to be done. If you have not done, you give the reason. As this is the examination hall and so many candidates are there, I did not find it suitable to do PR examination, as every candidate who have been allotted that case, it goes for the PR or PV examination. This will cause a big discomfort to the patient. But there are few cases. Say if you got the case related to some bleeding per rectum or lump per rectum, definitely you have to go do for it. But for other cases like breast examination, sometimes important, like hernia examination, or you have to do it. And if you have not done it, you have to mention it this way, that I would have liked to do this PVPR examination, but at this examination hall and so many candidates are there, I did not felt it, or the patient was not comfortable, or patient did not consent about it. Even then, if examiner insists, you go and do the PR examination or PV examination, then you can definitely do it. Now, this was about the general, about the surgical case presentation. Few other important things what I would like to highlight is, when you enter the examination hall and when the case is allotted to you and you go on bedside of the patient, never ever jump for the case. Never ever try to just try to find out what the lump. Sometimes I find a student, they ask the other candidate who has already taken that case. Never do this. Everyone has got their different finding, as everyone has got their different feeling in the hand. So everyone has a different finding. Don't go for it. Have a confidence. If at any level you find that you are not confident about that particular, don't just write anything. Don't do blunder mistake. As I say, you have told 10 things very correctly and 2 things you have done a blunder mistake. Now these 2 blunder mistakes are going to affect your another 10 things, and your marks will be decreased. So whenever any examiner asks some question to you, a very important thing, then make it sure when the question has been asked to you, first listen to the question. Give yourself half a minute to 1 minute. Think about what you are going to utter. I find many candidates, as soon as the question is asked to them, they just start uttering whatever comes in their mouth, and in that they spell or they just tell few things which comes in the category of blunder mistake. And after that, after you have done a blunder mistake, examiner will have a very bad impression about you, and he will not consider much whatever you do in your further examination, but that particular blunder mistake will revolve in his head. So don't try to make a blunder mistake. If you don't know answer to any question, you can very politely say, sir, I am not able to recall it at present, I am not able to recall it, so I am not able to tell you. So for one or two questions you can give this, because examiner also knows that during the examination time, everybody the level of the adrenaline increases. You are afraid, because we too have passed through this particular scene, and we have got a lot of consideration for the student. Every examiner wants that the candidates should pass, and few examiners I find, they keep on poking you, they keep on giving you hints, and they have got the ability to extract the answer from you. The most of the examiners are very good, but you have to be prepared for other type of examiners also who have got a bit less patience. So from your side, don't commit any blunder mistake, and be very careful whatever you see. So I think I have this particular video will help you in one way or the other. And if you like this video, you share it, you subscribe it on my YouTube channel, and share it with the other students, and tell them to subscribe it. I will be coming with different case presentation in the surgery department, which will help you in passing your examination. I hope you enjoyed my lecture. Thank you very much. Thanks a lot.